So good morning, good afternoon, good evening. This depends on where you're watching from. My name is Zippy the Nurse on YouTube. So if you're a new subscriber, thank you so much for coming. I don't take it for granted. And if you're a returning subscriber, thank you so much for being here, for being loyal, and for being everything. So today is 1 week later after the hurricane, like after what happened. Guys, it has not been easy, but by the grace of God, we've managed. So many people lost their lives, others lost their properties. Like, the damage is real. But one thing I'll have to appreciate, and will have to agree with me, all of you guys, is the systems here in America, they work. People like got affected, but I don't think there's anybody who is sleeping hungry. Like, I'll just say, frankly speaking, the systems in America's work. And for this reason, guys, I had promised you that I would make a video to show you that if you're a nurse out there who've been struggling in Kenya with the procedures that we carry out in Kenya, in this case, I'm referring to where I come from, because in the hospitals that I used to work in Kenya for the 15 years that I was a nurse in Kenya, we used not to have things that are minding the back home. How do I call it? We didn't have things. How do I explain it? Things are there, but the systems are not working like the way they are working here. In this case, I mean, if you had a patient who is about, let's say 200 kgs, and you're my size, because me, I'm very tiny, you'll have to turn this patient, because turning 2 hourly is an access procedure. And in this case, we mean you have to turn that patient to avoid bed sores, and then, to avoid so many other complications that comes with not turning and staying in one position. At some point, we normally say in nursing or in medical field that if you stay in bed for a long time, it makes you prone to other conditions like your blood stagnating, you end up getting blood clots, DVT and all that. So you need to mobilize that patient. I used to work in a cardiothoracic ICU, and we used to say the earlier you get that patient out of bed, the better. So how do we use, or what mechanics do we use getting patients out of bed in Kenya? By use of our hands. So you can imagine a scenario whereby I need to lift Zippy from the bed to the chair because she needs to be ambulated out of bed to prevent the complications that comes with staying in bed, the post-operative complications related to you're not moving. You know, if you're a nurse, if you're a medic and you're watching this video, you'll understand. But here, things are different. If I want, you definitely know that when you prop up a patient in bed, they normally tend to slide downwards towards the foot of the bed. So if you want to bring that patient back towards the head of the bed, I don't know whether it's making sense how I'm explaining. How do you do it? You have to use a draw sheet. In this case, I'm referring back home. You have to use a draw sheet to scooch that patient back, and then you prop up that bed. But here things are very different. You use what we call a sliding sheet to scooch that patient upwards, and then you prop up the patient. You use different mechanicals to lift a patient from the bed to the chair, or ambulate that patient. You know, if a patient needs to use a commode, you don't have to call people. Back home we used to call, I used to look for Stanley the Explorer and tell him, hey Stanley, Niaje, come and help me to turn this patient, come and help me to ambulate this patient because my patient needs to use a commode or something. Hey Monica, come and, you need to get people. So you'll get an excuse. Or there's some people who are just there, and then they just don't feel I don't want to use the word lazy, but they feel it's not a must for me to do it because I'll give an excuse. I didn't get people to leave that patient. Maybe you want to mobilize that patient to move from a bed to a stretcher. Things here have been made so easy. A good example is during this Hurricane Helen that has affected people. Systems have really worked to see people they have food, you find that people have clothes, things are working out, the system is working. So for you to understand what I'm saying, please watch the upcoming video because I went an extra mile and made the video for you So guys, don't disappoint me. We are almost 3,000. Can you share these videos until we get to 3,000 subscribers? And again, I mentioned sometimes back and said, if you don't subscribe, your punishment is waiting. Guys, it was on a light note. I was joking. I like joking. Those people who know me personally, I like joking, but I know it might not land in safe hands. So I take that back and I say, subscribing is free. It doesn't cost you anything. It doesn't cost you even a bob. So just subscribe. And if you feel that this video has benefited you in a way, let the other person benefit it as well. I want to bring Nursing in America closer to your screens so that you're able to know what to expect when you're coming here. When we were coming during our time, like I personally, there's so many things I wish to understand, I wish to know, but they were not, like, I was not getting the clear picture. I want you to visualize, conceptualize, and by the time you're landing here, it becomes easier because you'll be like, hey, I saw Zippy do this. I'll try as much as possible. 7 days we've not had electricity. So even if I make a video, it was not making sense why I'm making that video, recording the video, yet it will not be posted. So now I will try as much as possible to give you videos back. Do not forget to share. Do not forget to like. Do not forget to leave a comment. And I think, because I've seen so many questions that I'm not able to type them back, I'll also do another live next week to do a Q&A and answer all your questions to my understanding and to my capability. So yes, thank you guys. I don't take it for granted. I thank you so much for your support. We are learning. I hope I'm trying to reduce the Kiswahili in me. I'm trying as much as possible to speak in English so that we reach a wider and wider audience. So thank you so much, guys.
I have performance anxiety, guys. Wow. So, then count. So this way. That seems too high. Too low down.
The bend?
No, this does. There we go.
That's fine.
I think so. Does that seem right?
Yeah, it's got to be up on her head, and then you come under her legs
Yeah.
and crisscross.
Is that okay? Come down just a little bit. So, that should be good. Yeah.
Yeah, because you want her legs, I mean, like her head to fit in the top
Yeah,
of that.
it goes through here.
Yep.
And then this comes up this way. So,
The patient is very active.
very active and very helpful.
Very cutesy and very demure.
Very demure. So go ahead and move it back. Yeah, just. Much better. Yeah. I just did it. You can do it. You learned. I think I did this by myself at my old job. Oh. When I was a CNA at a nursing home.
I did when you were at you didn't have 2 people at a nursing home?
Nope, I didn't. We usually didn't even use them. If we had 2 people, we just didn't use them.
But our lifts were different too, you know?
Nope, we had these ones.
But no, I always did it by myself too.
The patient is just
Enjoying the ride. Enjoying the ride. I'm just nervous. I don't want to hurt you. No. There we go.
I am stable. I'll
Yes.
just jump,
Yeah. Grab hold or something.
grab everything around.
Yeah, I did it. You want us to do the other one?
Can this go on that one? I think so. Oh, what is that? What are you doing up? Oh.
I'm with everything.
Then we go back to the bed.
With the bed, show me the way back and forth.
Mm-hmm. So the patient will be moved
somebody
through.
was in that, like they'd be doing a split.
That's what I was interested.
Like this.
And then they're gonna sit down on that chair. Let's make the patient sit down on that chair.
Okay.
Uh-huh.
You can do that.
The first time I was so mesmerized, I was like, oh gosh, see this? Now assuming that's a patient who is seated down there. And then they'll be brought all the way up to the chair.
These guys don't like floor ladder and their legs.
Yeah, even nursing homes. My friend.
We had lifts, but we didn't have
What?
time. Girl, I like just like a
This is interesting.
Yeah. Because I ended up having
The
to have
patient
another
goes to
shoulder surgery
bed.
because I tore my rotator cuff again.
And you said this is for huge patients. Like this is a bariatric bed.
Yeah,
600 pounds. I don't know whether I can. No, it's not even showing. But this is for 600 pounds. Not tiny people like me. I don't know whether you guys got the concept. Did you see me sliding all the way going upwards? So assuming that is a patient who is on bed, you will not need to use your you don't need to use your energy to pull out that bed patient like the way we normally use draw sheets and stuff, because you'll just need to press on these buttons here, like, you know, I don't know whether you're able to see. There are two buttons there, like these two. So once you press on them, the bed sheets just keep on rising, like it keeps on going up and up and up. So let's assume this is our patient, right? And then we press on this. You see? Did you get the concept, guys? I hope you did. Please don't forget to like, share, and subscribe so that we learn, because every day we are learning. This is something which was so fascinating for me, a sliding bed sheet. Like you don't need to break your backs while lifting patients, sliding, scooching up patients and stuff. So that is it for today. Bye.